Hello and welcome to today's round. Our patient for discussion today is Maya, a 4-week-old baby. She was born at term with no antenatal concerns. She was noticed to be mildly jaundiced on day 5 of life. This was initially thought to be physiologic, and parents were reassured that it would settle. However, the jaundice progressively worsened over the next 2 weeks. She also started passing dark urine and pale stools, necessitating a visit to the pediatrician. Her blood investigations showed elevated conjugated bilirubin and deranged liver function. An abdominal ultrasound scan showed features suggestive of biliary atresia. Biliary atresia is a progressive fibro-obliterative disease of the extrahepatic biliary tree that results in obstruction of normal bile flow. It is the most common cause of jaundice in newborns that requires surgical intervention, and the most common indication for liver transplantation in children worldwide. The specific cause of biliary atresia remains largely unknown. It is thought to result from a combination of factors, including genetic susceptibility, abnormalities in bile duct development, immune-mediated mechanisms, and possibly infectious triggers. Several genes and viruses have been investigated, but no single cause has been established. Biliary atresia can be classified anatomically into 3 types. Type 1 involves atresia of the common bile duct. Type 2 involves atresia of the common bile duct and hepatic ducts. And Type 3 involves atresia of the extrahepatic bile ducts up to the porta hepatis, which is the junction between the intra- and extrahepatic biliary tract. Type 3 disease is the most common type, occurring in over 90% of cases. As I mentioned earlier, normal bile flow into the intestine is obstructed at the atretic segment. This causes buildup of conjugated bilirubin in the liver and spill into the bloodstream. This causes progressive liver injury, fibrosis, and eventually irreversible liver cirrhosis. The clinical history of biliary atresia is that of an infant with persistent jaundice lasting over 2 weeks after birth, who also passes dark-coloured urine and pale or clay-coloured stools. The pale stools occur because little or no bile reaches the intestine, and the dark urine is due to the excess conjugated bilirubin being excreted by the kidneys. In more advanced disease, the infant may develop hepatomegaly, splenomegaly, ascites, and poor growth. Vitamin K deficiency can also occur because bile is required for the absorption of fat-soluble vitamins, which can result in an increased tendency to bleed. Investigations for diagnosis include a liver function test, which shows conjugated hyperbilirubinemia, a urinalysis, which shows bilirubinuria, and an abdominal ultrasound scan, which shows an absent gallbladder or the characteristic triangular cord sign. The definitive diagnosis, however, is usually established with an intraoperative cholangiogram. During this procedure, contrast is injected into the biliary system, usually through the gallbladder, to determine whether the extrahepatic and intrahepatic bile ducts are patent. If biliary atresia is confirmed, the surgeon can proceed directly to treatment. Treatment of biliary atresia is surgical, and the operation is known as the Kasai procedure. During the procedure, the abnormal extrahepatic biliary remnants are removed, and a loop of small intestine is brought up and connected directly to the porta hepatis. Hence, another name for the operation is a portoenterostomy. One very crucial fact to remember is that timing of the surgery matters. It should ideally be done before the child is 60 days old, to reduce the chances of irreversible liver damage. In children with very advanced disease, or where liver failure has already occurred, the surgical management is usually a liver transplantation. The key message to remember is that any infant with jaundice persisting beyond 2 weeks, particularly with pale stools, dark urine, and conjugated hyperbilirubinemia, needs urgent evaluation for biliary atresia, as it is time critical. Thanks for watching, and I'll see you in my next video.